Good afternoon, everyone. We are the Group 2 and we will be assessing the information that was identified by the Group 1, which are the subjective and the objective information and other vital informations that could be helpful for the assessment of the case of the patient. So the first task is to assess the severity of acute alcohol withdrawal syndrome based on the subjective and objective information available. So before we go to the assessment, let us first discuss the parameters we use to arrive with our assessment. So the first is, we can categorize it as mild when the symptoms are anxiety, insomnia, nausea, mood swings, loss of appetite, depression, and abdominal pain, and this usually occurs 8 hours after last alcoholic drink. So second, we can categorize it as moderate if the symptoms are high blood pressure, increased body temperature, excessive sweating, unusual heart rate, irritability, and confusion. And these symptoms usually occurs 24 to 72 hours after the last alcoholic drink. And lastly, we can categorize it as severe or delirium tremens if the symptoms are various types of hallucinations, fever, seizures, severe agitation, and major depression. And this usually occurs more than 72 hours after the last alcoholic drink or may persist for weeks, sometimes months, if left untreated.
For the assessment, based on the previous slide, the severity is moderate. The duration, which is 48 hours after the last consumption of alcohol, falls under the moderate stage wherein it has 24 to 72 hours mark. The patient is also experiencing high body temperature of 38.3 degrees Celsius, which is above normal, that is 37 degrees Celsius. For the blood pressure, he also has a high blood pressure of 150 over 85 millimeter of mercury. The patient also experienced confusion, sweating, and shakiness based on his review of systems supported by his physical examination and mental status, stating that the patient is confused and has tremor in both hands. However, the patient is not experiencing hallucination as the neuroexamination states that the patient is awake and oriented. For the second part of assessing the information, create a list of the patient's drug therapy problems and prioritize them. Include an assessment of medication appropriateness, effectiveness, safety, and patient adherence. First is the dose. Subtherapeutic dose means lower than the recommended range and it is less than therapeutic. Ang standard initial dose for hydrochlorothiazide is 25 milligrams once daily. If your blood pressure is still high after taking this drug, your doctor can raise your prescription to 50 milligrams daily, given as a single or two split doses. So the height of the patient is 6 feet 6 inches and his weight is 76 kilograms. It is possible that the 25 milligrams hydrochlorothiazide once daily is not enough to lower his blood pressure.
Next, we have iatrogenic disease, adverse drug reaction. Hydrochlorothiazide may potentiate orthostatic hypotension with alcohol. Orthostatic hypotension is a form of low blood pressure that happens when standing, after sitting or lying down, and it can also be made worse by concurrent use of alcohol, narcotics, or antihypertensive drugs. Going back to the assessment, it is stated that there was a possible witnessed seizure. Seizures can occur if blood pressure is sufficiently low. The body goes into a seizure state as a way of reacting to the low blood pressure to attempt to sustain the body's function during the lack of blood flow, which consequently causes low oxygen levels in the body. Therefore, hydrochlorothiazide with alcohol might be the reason why our patient experienced a seizure.
Another drug therapy problem is patient education. The patient is not aware of alcohol-drug interaction. not known to him that consuming alcohol while taking hypertensive drugs could lead to ineffective therapy or some adverse effects. In this case, he takes amlodipine to manage his hypertension, and he drinks alcohol at the same time. This could lead to lower the blood pressure more than it should, and excessive low blood pressure can cause drowsiness, dizziness, headaches, or seizures in the worst scenarios. Thus, it is important for him to know such informations.
So, after identifying the drug therapy problems, they are prioritized into the number one priority, which is acute and serious. The aforementioned drug therapy problems could possibly be life threatening, and there is no time to waste in solving it. In other words, these are the problems where the aims of treatment are not being met and could harm the patient if not resolved immediately.
The assessment. The patient has a history of alcohol addiction and dependency, alcohol withdrawal with seizures 4 years ago, and he takes hydrochlorothiazide 25 mg once daily to manage this. He also has hypertension for 10 years and is taking 5 mg of amlodipine once daily. He also takes 20 mg of omeprazole for his heartburn since he has a GERD. His height is 6 feet and 6 inches, has a weight of 76 kilograms, and he may possibly have renal or liver problem as a result of 22 years of alcohol usage.
For his GERD and hypertension, he can use proton pump inhibitors. His hypertension medication, hydrochlorothiazide and amlodipine, can cause GERD or acid reflux. If the patient takes proton pump inhibitors, a type of acid reflux treatment, and decreases stomach acids, both his GERD symptoms and blood pressure improve. For alcohol dependence, increased sodium consumption would be advantageous for drinkers since it helps control fluids in the body, which impacts blood pressure and is essential for muscle and nerve function. Individuals with the disease must also consume calcium. In pharmaceuticals, acamprosate calcium is recommended for the maintenance of abstinence of alcohol in patients who are abstinent at the start of the treatment.
The patient plans to stop consuming alcohol, it is recommended not to discontinue alcohol suddenly as it might lead to certain complications like characteristic syndromes like motor agitation or the excessive motor activity associated with the feeling of tension and anxiety and insomnia and seizure. So as we know, it is stated that the patient's typical daily consumption for the past 25 years has averaged about 14 to 18 alcoholic beverages while also smoking for 5 years. The patient is also unemployed and he has not worked for the past 6 months, and him being unemployed could be a factor contributing to a sedentary lifestyle. So abrupt alcohol withdrawal might lead into certain complications. That is why the purpose or objective of drug therapy in alcohol withdrawal is to prevent the presence of seizure, delirium, and the mental state where you are confused or disoriented and arrhythmia.